Don't move, Carly, trust me.
Don't look at it, Carly.
No. You're supposed to just like trust that went in. Welcome back. We are using Flex Balm. It's locally made, and there'll be a link below for that, along with his link, maybe another link. I don't know how many links we're doing, but that stuff's really good. It's like a muscle balm. It has capsicum, menthol. It has CBD for anti-inflammatory effects, and it's got essential oils as well. I'm more on the understanding that the analgesics are just good for general achiness in an area, and it's really good to apply this stuff, especially prior to movement, because it just makes you more likely to kind of provide quality movement to that area and like get over the hump, if you will, like soreness, tension, pain. Because movement is very therapeutic. We just sometimes have a hard time kind of leaning into it when we're hurting. So that's that stuff. That's Flex Balm. Colin, you can use it on your shoulder before you go play. It'll help quite a bit, especially if you have like compression sleeves. Man, what I used to see the pitchers use for the Oreos is they would use tire balm. It's the same thing. It's not the same thing. That's probably, I would say that's better quality. I feel like it lasts a lot longer. But a lot of different products out there, and they would put a bunch of it on, and then they would put their sleeve over that stuff, and then go throw and warm up. And it probably felt like their arm was like 1,000 degrees, but it allows them to put some velocity on the ball quickly. All right, bring your knee up to your chest, and then bring it behind you, and extend, and then relax, and extend and relax as you do that. Let your leg drop. I got you. You okay?
Yeah, just tight.
Yeah. Bring your knee up again. And again. So with these ones, let's just do like a fast forward. So that would be in the middle of that fast forward. Alright, let your leg drop. And then really let it fold.
I mean, I'm trying.
Bring your knee up.
Oh, man.
You're good right there. Hang that for 5, 4, 3, 2, 1. Go to a comfortable range. Go back. Let's bring it up. Right there, I want you to try to squeeze your knee to your chest as hard as you can. Maintain it, push your elbow into it as well. Bring your elbow to your knee. Push together. For 5, easy, 4. Maintain your back, get a good shake. 3, 2, 1, relax. Extend both. Just get along through the heel. Along through that heel, straighten your knee. Come on, your back.
Oh, man.
All right, buddy. Did you go to the block party last week?
I did not.
Me either. We had a...
Looked like there was a lot of people that went up there, though.
That's good. Are you still kind of helping out with stuff in the community?
Less so. I just don't have any time right now.
Are you busy? Lacrosse tournaments?
Lacrosse tournaments everywhere. Field hockey stuff for the other girls.
So you might not be in Baltimore, but every dad and mom in Baltimore on their weekends in the summer is hanging out in a random field somewhere in Maryland.
That was Father's Day.
Tournaments. Oh, that was Father's Day?
Father's Day Complex.
Was that really? Happy Father's Day. I'll leave it on this. Oh man. Like, and so to put into more perspective relative to that, I guess probably soccer would be the most easiest thing to recognize it locally to wherever you are. But people play in the summer, so you get recruited to play in high school and in college. So like, and for skill development, it's fun. Kids are enjoying it, but it's a big recruiting platform. Release here, relax your shoulders. So I went through that whole routine here. And I played for a few years in college. Nice. Line your side, this side up for me. Take your time, Colin.
They had all those tournaments back then when you were playing?
Not as intense at a young age, but like it was what your kids are probably experiencing now. It started around like 9th grade, 8th grade. It was like most of us were doing that. Where we would, but maybe not as often too. It was more like once a month, not every weekend of the whole summer. Where there's just so much competition going on. I gotcha.
Ow, my shoulder's caught on something. Sorry.
No, you're good. Here you go. Is that better?
I think so.
Still good? Oh, seems like it. Relax. Just like that. Good. Come on, your back. And then roll on your side, face that way. So for Colin, his low back doesn't like a lot of flexion and rotation when I set him up to adjust him. So I just did the other side in a different way, but I'll show you. I keep him stacked in extension and then create lateral flexion down. He moves a lot easier that way. Just drop your hip for me though. Good. Drop. Good. On your back. So you spent the day out on the field on Sunday.
Yeah,
Saturday. That's just for one of them, right?
Yes.
The oldest is really into lacrosse.
And they played a team from Houston. They played a team from Ohio.
That's crazy, man.
And they're in like a lower division.
I know we probably have nothing to complain about. They're always traveling down to us.
To Edgewood.
Yeah, to Edgewood.
I mean, like Houston to Edgewood.
I know. That's crazy. There we go. Your shoulder here. Okay, turn your head to your left. Reach your muscle over the back. And when I roll you back, just let it roll. Oh, good. Oh, that's good. Turn your head to your right.
It's a spot that looks like it.
Biting on you in the dry needle, right? Yeah. I'm palpating over that rib head just below it, and it's moving just fine. Easy under there. See, it's that easy. Easy. Relax your jaw.
Oh!
Yeah. You good? Yeah. That was a good release. Yeah. I appreciate the trust in me, Colin. Alright, let me get that one spot in your shoulder and then you're out of here, man.
Alright.
Alright? If I keep you here any longer, your kid's gonna be mad at me and my front desk is gonna be mad at me. Don't move, Carly, trust me. Oh. Don't look at it, Carly.
No.
You're supposed to just like trust that went in. No, it's okay.
Can't let them.
Nothing, no trust there. Head back for me. Head down. So Colin, thank you for taking time to do this video with me. I appreciate you as a patient, as a neighbor. Head back and what you're doing as a business owner too. It's impressive, man. Bring your chin to your chest.
Well, you guys got a great channel and a great practice.
Thanks, man.
And so it's fun popping in and seeing some of the videos that you guys are doing and some of the newer treatments that you guys do for people.
Yeah, trying to stay on top of it. So we added, I don't know if I told you this earlier, we added primary care. So we've got a functional nurse practitioner just joined our team. So we'll be doing
Nice.
IV infusions and eventually peptide therapy, PRP, stem cell treatment, ultrasound guided injections, and right now she's going to be working more on the primary care role because that's where she comes from. But we're advancing into that field. So having a little bit more of a hope, like taking it to that level of holistic care.
Right.
And like-minded individual, lacrosse player, like everybody here. Turn your head to your left. Played collegiate lacrosse at Georgetown. Worked in emergency room medicine for a long time, and then got her NP and has been in the primary care setting prior to this. But she'll be joining our team officially in 2 weeks. She's here today, so it's our first day with her. It's a big deal. Bring your arm across your body for me. You just gotta look from Jayla. Head down again. Bring it across again. Right there, I got you. Hit that lacrosse ball and do those 2 motions right on the spot where my thumb is. And just spend like 2-3 minutes loosening it up and warming it up.
Okay.
And then do like, think like cat-cow with the upper spine.
Right.
I've shown you different ways of hitting that space, but your spine here just needs to loosen up just a little bit, in my opinion. And then I think you'll have a really good match.
Okay.
Alright?
Let's just do that on the wall.
You can do those elbow slides along the wall, yeah.
Okay.
Yeah. And a lacrosse ball pushing up against the wall, I know, I feel you. Head down though. There it is. Life's good, man. Good to see you.
All right.